بسم الله الرحمن الرحيم. First of all, I would like to thank all people shared in my course, and I have to say a lot of candidates shared in these discussions and the courses, and all of us worked together as a team. The next generation that preparing for bases, they are lucky because if they hear the discussions and the lectures, they will take a lot of benefit from this discussion, not from me only, it's from all candidates participating in it. We have a great person that participate, and we have a pioneer doctor participate in these discussions. And I would like to say, I have to give a special thanks to Dr. Gamal Allam. This great person, he recorded all cases and all scenarios and keep it with him. Next generation will take a lot of information from this record, and my Allah, our Allah and our God give him a lot for his work. Once again also, I would like to extend my thanks to Dr. Al-Khatib for his effort and for his caring to collect all videos and all lectures and upload it on Facebook or YouTube. And also he has a lot of suggestions, and one of these suggestions, this is a lecture that I am going to do it to take a benefit, to give a benefit for all candidates. Thank you, Dr. Gamal. Thank you, Dr. Khatib, for your efforts. First of all, I am really pleased to have studied with all. I am confident that by doing this course, you will give yourself the best chance when the exam day comes. How to pass phases. There is some keys of pass phases. First key is identifying your goal and maintain focus in your game. You have to make a plan. You have to follow instructions. You have to train the way you want to play. You have to make rehearsal. You have to turn your weakness into your strength. You have to avoid negative self-talk and negative verbalizations. You have to monitor your workouts and evaluate your progress. This is some keys to pass basis. I will speak about it in details. First one, identify your goal and maintaining focus in your game. Our goal to pass bases from the first attempt. You have to focus in your game. The single most powerful predictor of success in the long run is commitment. Everyone wants a quick fix, but that is as unrealistic for improving your clinical skills. If you watch what someone else is doing, then you are not focusing on what you need to do. We have to learn from others, but we have to improve ourselves. Just because someone passed the exam, don't assume it was easy for them. Success is not a matter of luck. Discipline is remember what you want. The only discipline that lasts is self-discipline. Keys. Planning. You have to make a plan. Make preparation in advance. You never have trouble if you are prepared for it. Failing to plan is planning to fail. The chances of success are definitely increased with proper planning. Plan each and everything to its last detail, and this way you will definitely reduce your stress levels. Concentrate on your preparation and will be able to keep unwanted situation at bay. You have to make for yourself long-term plan and short-term plan. Long-term plan, review all tests, review notes daily, and keep up with practicing. Join a study group. Short-term plan, 1 week before the exam, prepare a study schedule. Rapid review of all stations. Review your notes. Try to be near from optimistic candidates. Follow instructions. Follow instruction of expertise person. Follow the philosophy of do it now, do it right. Follow instruction is a relatively simple, but it is very important skill. What kind of person you want to be? If you want to change the kind of candidate you are, change the kind of person you are. You are what you say and do. Train the way you want to play. There are two phases of our mind, conscious mind and subconscious mind. Subconscious mind is the unseen phase of our mind. It knows no limitation and has the capacity to accomplish all of our goals and ambitions. Your subconscious mind is at work at all time. It doesn't matter if you are awake or asleep. Let's see how we develop any new skill or habit. Initially, when we are learning the skill, we are using our conscious mind all the time. Later on, with repeated practice, we rely less and less on the conscious mind because our subconscious mind takes over the task and it allows us to perform the skill without much thinking by the conscious mind. You learn any skill with your conscious attention and with sufficient practice. This handed over to our subconscious mind, and when the moment comes, the task or the skill is performed with perfection. In practicing your clinical skills, you need to do the same things in the same way as you will when you use them in actual situations. Learning doesn't occur as a smooth, seamless, steady process. Learning involves integration new information with existing information. The brain needs time for restructuring. The brain needs time for restructuring and consolidation. It takes time for the brain to accommodate new input. Make rehearsal. It is the fifth go. It is the fifth steps in preparation for basis. Make rehearsal. This means imagine yourself doing something successful before you actually begin it. It's like a move you run in your head. If I can conceive it, I can believe it. If I can believe it, I can achieve it. Repeated practice, both mental rehearsal and actual practice, can do wonders on the day of exam when you are performing in front of examiner. It is very important for the conscious mind to concentrate on the task it's facing and not think of anything else. If you have done your homework well, done enough mental and clinical practicing, on the day of exam, you will be concentrating on the clinical skills, science, and at the same time, your examination sequence will be effortless. Think what is going to happen if you turn your weakness into your strength. Look at things you feel uncomfortable doing, you find frustrating, or you feel you are not good at. It's important that you don't ignore these things with a hope that you may not encounter these in the examination. These are the things which you can decide between a pass and a fail. Number 7, avoid negative self-talk and negative verbalizations. Many candidates have the habit of negative self-talk. This is too hard. I will never get this. Or this is hopeless. Whenever you have a thought like this, please stop it. Number 8, follow up your workouts and evaluate your progress. Follow up your workouts. Assess your own performance. Know why you missed an item. If you didn't find out why you missed the items, then you will have lost the opportunity to learn, and you have wasted the time you spent doing the activity. This is 8 steps to pass basis. The next is yours. Now it is your step. If you did all steps, be sure and confident you will pass. Once again, congratulations in your participate in my course. I am excited about the opportunity to share my information with you. This is the introduction, how to prepare yourself to pass an exam. Again, I would like to thank Dr. Khatib. The one will take this lecture and will convert it to videos and share it for others in the Facebook or in YouTube. Good luck for all. See you in the next session. Bismillahirrahmanirrahim. Today I am going to speak about introduction to communication station. This is a simple lecture about the introduction of communication station, and after that, in the next lectures and meeting, I will speak about the pathway of each cases maybe you will encounter in the exam. Let us first to agree the ethics and the communication station, as the name implies, is designed to test the candid understanding of the core concepts of medical ethics. The ability to discuss about a disease condition and the way the communication is carried out with patient, caregiver or relative or colleagues. You must make sure that the interview is carried out in plain language that easily understandable by non-medical person and to avoid any medical jargon. Communication station. It is very easy to pass and get a clear pass in this station, provided that you have taken a time to study the core concepts of communications and ethics. The mistake that candidates commonly make is to read a lot of books without developing any basic understanding of the medical ethics and law. If you are aware of your duties and ethical principles, you should be able to deal with any situation. For this, you don't have to read big books on the subject. Rather, you will be provided with a concise outline of core concepts which should sufficient for most scenarios that are encountered in the examination. First of all, to pass communication station, you have to know the four skills in these stations and how your performance have been assessed in the communication station. It is the most important issue to know what is the item you have to cover it in this station, and you have to fill these items during encounter the case in the exam. As we know that we have in this station four skills: clinical communication skills, managing the patient concern, clinical judgment, and managing the patient welfare. Each skills from these four skills has a parameter. You have to cover it clearly and you have to know what is wrong and what is the right in each skills. First skill, clinical communication skills. What does that mean? First, you have to explain clinical information to the patient. As we said, clear to maybe clear and avoid medical jargon, should be structured and comprehensive in a professional manner. That is mean clinical communication skills. To explain everything for the patient, accurate information and clear information in non-medical term, comprehensive and in professional way. The problem here if the candidate didn't give clear information for the patient. This is a problem. Or the candidate use medical jargons. Jargons means that medical terms. Or the candidate, his way is not professional or unpractical. This is the first skills, clinical communication skills. Second skills here, managing the patient concern. In this skills we have three items. Number one, to answer the patient concern. Number two, confirm the patient understanding. Number three, to become sympathy and empathy with the patient. So that we in this skills we have three items again: to answer the patient concern, number two, to be sympathy with the patient, number three, to confirm knowledge and understanding of the patient. The problem, if you forget to answer concern, if your way of dealing with the patient is not in sympathy or empathy way, or you forget to check understanding for the patient. Skill number three, clinical judgment. It means that you have to select proper management plan for the patient, for his case. This is number one. Number two, to apply your clinical knowledge, including ethics and law. Clinical judgment has two items. First item is to explain the management plan for the patient. Number two, to apply clinical knowledge, including ethics and law. The problem here, if you forget to apply your clinical and ethical issue, or you didn't explain management plan in proper way. Last skill is managing the patient welfare. It means you have to treat your patient respectfully and sensitively and ensure the patient is safely and dignity during the discussion, and avoid any physical or emotional discomfort to the patient. So we have four skills. Each skills have item, and each items should be complete during discussion. This is how your performance assessed in communication station. We have common cases in bases, and each case have a pathway different from other case. So in future or in the coming lectures, I will explain the pathway for each item. Common cases here: breaking bad news could be curable or non-curable cancer or chronic progressive disease. Maybe explain new diagnosis for the patient, chronic illness or acute illness. Maybe counseling the patient about chronic illness, about the management plan, dealing with angry patient or relatives, discussion the diagnosis with relative, discussion procedure with patient or relative, DNR, withholding medical treatment, long-term care for patient. This patient is candidate for ventilation or not, and also organ donation. At the same time, we have common case post-mortem examination, hospital post-mortem or refer to the coroner. Genetic test, one of the famous case in the exam. HIV test, needle stick injury, deliberate self-harm, any medical problem with pregnancy like pulmonary embolism, epilepsy, HOCM, peripartum cardiomyopathy, tuberculosis, thyrotoxicosis, and hypothyroidism. Any infectious or notifiable disease like HIV, meningitis, and chickenpox, tuberculosis also. In general, for communication, we have some rules and some issue we have to cover it. Each scenario have medical issue to know how is your medical knowledge, to cover it in the clinical judgment, or ethical issue, or legal issues, or social issues related to patient job, or public issues related to other person sharing condition with the patient. At least you have ethical, medical, and legal issues. Sometimes maybe social issues and the public issues, and I will mention that in the next slides. What is the ethical issue in communication? We have main ethical issue. First one is called autonomy. What does that mean? Autonomy, you have to respect the patient's wishes and decisions. If the patient decides he doesn't agree about your medical treatment and the patient have capacity, we have to agree about that, and we have to respect the patient wishes. If the patient refuse any medical treatment and you feel that it is unwise decision for the patient and this patient has full capacity to take his decision, we have to respect. Autonomy, like consent, like charge against medical advice and refusal of treatment. That is the right of the patient, provided that this patient has capacity. Number two, doing the best for the patient. Patient best interest. It usually occurs if patient doesn't have capacity and the candidate discuss the patient condition with his relative. Assume that no advanced directive. Patient wishes and best interest for the patient, it is one of the most ethical dilemma in the communication station. You are explaining to one relative of the patient his condition. He has subdural hematoma and this patient is candidate now for urgent surgery to evacuate this hematoma. But his relative doesn't like to do for him, doesn't agree about the procedure. But you, as a doctor and the team looking after for patient, the best interest for this patient to doing the surgery. And there is no advanced directive written by the patient that he doesn't need the surgery. So we have to do the best interest for this patient. Actually, in the exam, it is don't make a confrontation with the patient or relative. Don't make confrontation with relative, and you have to make step by step to explain to him the benefit of the procedure and that the best interest for the patient and it is urgent procedure. So best interest for the patient, it usually occurs if the patient doesn't have capacity and the candidate discuss the patient condition with his relative. Again, assume that there is no advanced directive or last power attorney. Number three, avoid the harm of patient, even if we are unable to do good. It usually occurs when relative want to do for the patient something against clinical decision. This is avoid the harm. Sometimes relative want to do for the patient any decision and the medical team looking after for the patient doesn't agree about that. So we have to respect the decision of the medical team. There is a rule, no patient or family doesn't have right to decide what is the management plan for him, for patient or for relative. Patient have the right to refuse the management plan, but doesn't have the right to choose the management plan. Number four, justice. It means treat all patients equally. Also, avoid discrimination and abuse. In the exam, maybe you face one patient old age and the decision this patient is not candidate for resuscitation. and you are going to discuss the condition with the patient, with relative, and his son or his caregiver told you that, doctor, you take this decision because my father is old, so that your answer should be like that. We treat all patients equally. There is no any discrimination, and the decision is depend on the guidelines that we are follow it, and these guidelines approved by National Health Service. Number 5, breach confidentiality, and I will speak in the next lectures about it. And the capacity, we have to decide this patient has capacity or not, and I will explain in the next lectures. Public issue. Some diseases could be affect the public, could be affect other people, so that driving is very important. If you face any patient with diabetes, epilepsy, transient ischemic attack, stroke, heart disease, you have to raise the issue of driving. Maybe this bus driver, so that there is a guideline, and there is DVLA guideline according to each case, and like diabetes, epilepsy, there is guidelines. This patient candidate for drive or not, the license should be given to him or not, he has to inform DVLA or not. These guidelines, all of us have to read it carefully. Infectious and notifiable disease. Notifiable disease means we have to inform National Health Service about it, like meningitis, tuberculosis. It is very important. And also for the patient, for some disease could be transmitted to other people, like tuberculosis, isolation or not isolation. I will speak later in the case of tuberculosis about it. HIV, informal partner or not, it is very important. Meningitis, we have to trace contact, like TB also we have to trace contact. Hepatitis B virus and hepatitis C virus, inform his partner or not. Very important. This issue is HIV, hepatitis B and hepatitis C. We have to raise the issue of partner and to inform them and to try to convince the patient to inform his partner, and please again don't go in confrontation with the patient. If he doesn't agree to inform his partner at the time being, you have to inform him. At this time, please, you can use a barrier during intimate relationship, and after couple of weeks we can sit again, you will think in this issue, and you imagine that your partner know in the future will know in the future you have a medical problem, and you hold this information with her. Maybe she will feel frustrated from your decision. So HIV, I will speak later about it in details, about confidentiality and when we are going to breach the confidentiality. Medical legal issue. One of the most ethical dilemma also, medical legal issue, like breach confidentiality. When we have to breach confidentiality, patient candidate for resuscitation or not, post-mortem examination, refer to coroner or hospital post-mortem examination, organ donation and donation card, advance directive or and living will, withhold the treatment for this patient, end of life care asked by relatives, it's called euthanasia. All of this medical legal aspect. Social issue. Actually, there is no one written that as a separate issue, but I emphasized about it. Why? Because it is one of the most important issue. Always we forget it during discussion. Job. It is very important to ask the patient about his job. or relative about the job of the patient. It's a vital if you forget it. Why? Because the job could be the cause of his illness, so that this patient is candidate for compensation. Could be the job is a risk for the patient, like if the patient is epilepsy and he is a driver. This is a guideline for that. So that job is one of the most important social issues we have to raise it with the patient. Smoking and alcohol intake. We have to ask the patient about smoking and alcohol intake. Maybe you put in your mind there is no relation to smoking and alcohol, but I will give you an example. If the patient is tuberculosis and you were giving him rifampicin and isoniazid, so that this patient is heavy alcohol intake, so that his liver function could be affected by alcohol and the drug. Patient is bronchial asthma, you have to ask about smoking. It's called pre-morbid state for the patient. Marital status or sexual partner. Some scenario it is a vital, like HIV, hepatitis B, hepatitis C. If he is planning to be married, like if you are going to discuss hypothyroidism with the patient, and she is not married now, but maybe planning to be married and get baby in the future, so that you have to tell her that pre-natal care, the patient should her thyroid function normal, and once she get pregnant she has to increase the dose by 20 to 50 microgram, because her fetus is dependent on the her thyroid. Maybe when you are going to discuss the hypothyroidism you forget this. No relation. Why I will ask her about marital status? Thyrotoxicosis is the same. If you are going to discuss thyrotoxicosis with the patient, very vital. Are you planning to pregnant soon? Why? Propyluracil in the first trimester is candidate for this patient, and carbamazole after that. Who is taking care of the patient? Some scenario have patient new diagnosed as stroke, and this patient is taking care of his wife, and his wife has rheumatoid arthritis, and she has a lot of deformity, and she is wheelchair dependent. So you have to tell the patient, ask him in short, not in details, who's taking your care, in whom are you, or if he is taking care of other person in the home. If he is taking care of other person and he has medical problem interfere with that, we'll tell him, I will refer this issue to social worker. She will arrange that for you and she will help you a lot in this issue. Again, social issue. It is a vital. Job, smoking, alcohol intake, pre-morbid state, marital status, and sexual partner. Who is taking care of patient, or if the patient is taking care of other person in the home. This ethical issue, medical issue, and public issue, also social issue. We discussed it. Now I am going to make a busway. This busway will be for all cases. To put a plan, also will modify something according to each scenario. Imagine yourself now, you are going to exam. In communication station, you have 5 minutes waiting outside the room, and you have 14 minutes inside the room with the with the patient, and 1 minute for reflection. How can I arrange my time? 5 minutes before station. Once you sit, they will provide for you paper contain the scenario. If you don't have plan paper, request it from the organizer. Please, doctor, I want plan paper. Read your task carefully in 2 minutes. Read carefully. Read your rule and your job and the patient name, and read also what is your task. In 2 minutes, you have to decide what is the main medical issue, ethical issue, social issue, legal issue, and the public interest. You have to write the patient name. One of the most common mistake, as we usually during preparation before exam, we choose 3 to 4 names. Maybe because we usually use it, you forget the actual names that given to us in the during exam, and you by wrong call the patient by another name. So you have to write the patient name. You have to write your job. What's your job? You are a senior house officer, or you are a registrar. What is your job? You are a medical doctor or cardiology doctor, so that it is very important during discussion with the patient to tell him what is your job. يبقى 5 minutes, 2 minutes read your task, 1 minute you have to write your job, your name, the patient name, and your task. 3 minutes. Remaining 2 minutes in this 5 minutes. You have to divide the paper to 3 parts: introduction, main task, and end of discussion. Actually, during your preparation before exam, do it. It will be habit for you after that, and maybe you didn't need to write all of this during exam. Now you are going to discuss the condition with patient, conversation with the patient. Communication is hearing what is not said. Again, communication is hearing what is not said. You have 14 minutes inside the room with the patient. As I told you, we have 3 items: introduction, main task and concern, and end of discussion. Introduction, 1 to 2 minutes to introduce yourself, and will speak about the item of this introduction. Main task, concern, 2 minutes, end of discussions, 2 minutes. We have 5 to 6 items in introduction. Four items, it is the same in all. You have to greet the patient according to the time of exam. If you are going to exam in the morning, you tell him good morning. In the evening, you will inform him good evening, good afternoon in afternoon. Introduce yourself by telling him your name and your role. You have to identify your patient carefully by calling him by his name. Number 4, each meeting or every meeting we have to confirm agenda of the meeting or interview and take a consent from the patient. It is verbal consent. 4 items, it is the same in all scenarios, sorry. If you are speaking to a relative, ask him if he is the next of kin or no. Why? To avoid breach of confidentiality. Actually, if you are going to exam and speak with a relative, be sure that he is the next of kin. But we have to ask him. Sometimes it is written in the exam paper. Assume that the patient's son has a consent from his father to discuss the condition with you. So that it is written already. If not written, and the patient is conscious, We have to ask him, are you next of kin? Do you have a permission from your father to discuss the condition of me? If he is conscious. But if his father is not conscious and he know any not written in the paper that he has a consent from his father to speak with you and his patient is not conscious, just only ask him if it's next of kin or not. If we are going to break bad news, we have to ask the patient or relative, do you want anyone of your family to attend this meeting or no? So that we have 6 items. These 6 items in introduction we have to cover it. Number 1, greet the patient, introduce yourself, identify the patient, confirm the agenda. If you are speaking to a relative, ask him if he is next of kin or no. Number 6, if we are going to breaking bad news of patient, we have to ask, do you want anyone of your relative to attend this meeting or not? I will give an example now for this introduction. Assume that we have patient has chest pain and already we did for request for him CT pulmonary angio and we found that he has pulmonary embolism. And the patient written in the exam paper, you have to, his son, Mr. Ahmed Ibrahim, he is waiting you to discuss the condition of his father and assume that he has a consent from his father to discuss the condition with you. Let us now to tell the introduction. Good morning, Mr. Ahmed Ibrahim. I am Dr. Ahmed Maher, Senior House Officer in the Emergency Department. Nice to meet you. Nice to meet you, Doctor. Before starting the discussion about your father, I believe that you have a consent from your father to discuss his condition with me. I'm right? Yes, doctor, you are right. We are going today to discuss the result of imaging that request for your father. Is that okay for you? Yes, doctor. Do you want anyone of your family to attend this meeting with us? No, doctor, go on. This is a simple introduction. Good morning. I am Dr. Ahmed, Senior House Officer of Emergency Department. Greet the patient. I introduce myself. Are you Mr. Ahmed Ibrahim, the son of Mr. Ibrahim? Yes, doctor. Just identify your patient. Confirm the agenda. Before confirming the agenda, you have to ask him, I believe that you have a consent from your father to discuss the condition with me. That's right? Yes, doctor. Confirm the agenda. We are going to discuss the result of the imaging has been done for your father. Is that okay? Yes. It is breaking bad news. So that doctor, do you want anyone of your family to attend this meeting? This is introduction. يبقى introduction we have 6 items we have to cover it. If no breaking bad news, خلاص don't offer for him to any relative to attend the meeting with him. If you discuss the condition with patient, so that no need to tell him you have a consent or not, because you are discussing with the patient. This is introduction. Task. First, don't allow to the patient by his attitude to distract you about the protocol of communication in this part. Sometimes we face angry patient, and once you start the scenario, the patient shouting and he is angry and he distract you about the pathway. Please don't allow for him to do that. Let the patient to speak and don't interrupt him. You have to listen carefully with non-verbal clue by hitting your head, just making a sound during the patient speak, like that. It is non-verbal clue and is listening for the patient and one of the communication skill. We have some questions to ask the patient about that. Once you finished your discussion, as usual, in your clinic, If the patient come to see the result of investigation, or relative come to you to ask about his father or his mother, what is the first question for him? How do you feel now? This is the first question. How do you feel now? You have to start your communication after introduction for the patient. Mr. Ali, how do you feel now? If you are discussing with the relative, please, could you tell me how is your father now? It is very important to make a rapport with the patient. It is a two-way of discussion, this communication. Let the patient to speak and reply to him in sympathy and empathy manner. If the patient told you, doctor, I still feel pain, I have shortness of breath and loss weight, you have to reply, I am sorry for that. It is sympathy and empathy for the patient. You have to make this way in your discussion with the patient. Don't listen only. You have non-verbal clue and verbal clue. Don't interrupt, but it's just a matter of sympathy. First question, how do you feel now? Second question, how much you know about your illness? It is a very, very important question because the patient will tell him how much he is thinking. Patient has chest pain. When you told him, how do you feel now? He mentioned for you, I have pain. When you asked him how much you know about your illness, he told you that when I came to emergency room, I have this pain. But after that, he make a tracing for my heart, like it is ECG, but we are speaking now on medical term, tracing to my heart. And I feel better. I feel a little bit better. So that first question, how do you feel now? Second one, how much you know about your illness? Third one, do you know why we requested this investigation for you? It is very important to know what is inside the mind of the patient. Last one, what do you expect about the result of investigation? To know also what inside his mind. I expect that, doctor, it is a simple chest pain because I have coughed long time ago and travel abroad, so that maybe some bug could be bug inside the chest. He doesn't aware about pulmonary embolism at all, and the diagnosis was a pulmonary embolism. So now, before start the discussion, we have to ask the patient or relative, how do you feel now? Or how is your father feel now? How much you know about your illness? How much you know about your father's illness? Do you know why we requested this investigation for you? Or do you know why we requested this investigation for your father? What do you expect about the result of investigation? This is the 4 questions. Sometimes when you go to exam and patient was diagnosed as tuberculosis and he was isolated in the room, but no one told him why he isolated inside this room. So that when you ask the patient, how do you feel now? He will reply, I still have fever, doctor. I have weight loss and I don't know why you put me inside this room and all person dealing with me wearing gloves and no any contact and not allowed for me to go out without mask. No one informed me about that. This patient is angry. Maybe the patient will distract you about this protocol, so that you have to keep calm and reply in sympathy. I'm sorry for that. I will tell you everything. I am here to help you. Then start to ask him to tell the patient, could you tell me how much you know about your illness? He will tell you, I admitted inside the hospital and told me there is bug in the chest, but no one explained to me more about that. I am sorry for that. I will tell you everything about your condition. What do you know why we put you inside this room? No, doctor. Yes. What about your expectation about the result of your problem? I expect it could be simple bug in the chest. Then start after that the protocol for each case will speak. So this is your start. The first impression for the examiner is this area. Ask the patient, how do you feel now? Let him to speak freely and reply. Ask the patient how much you know about your illness. Ask the patient what do you expect about the result of investigation. Now it's your role. Explain the main task that given to you according to your scenario. And the main task is different in the pathway, so that we'll speak in each task later. But put in your mind you are a leader of the interview, so control the interview through professional manner. Don't rush by speak too much. You have to speak clearly, simple, and put in your mind communication station is two-way of discussion. Don't speak more than 2 minutes without interruption by the patient. If you are going to speak more than 2 minutes and no interruption for the patient, you have to stop yourself and tell the patient, are you with me? Are you following me? Is that clear for you? Or do you want from me to repeat everything for you, anything for you? To make interruption, to give attention for the examiner, you are not giving a lesson for the patient. It is not a lecture for the patient. It is a two-way discussion. So if your task, sometimes some tasks need more speaking and the patient is listening to you 3 minutes, 4 minutes, 5 minutes. It is not communication. It is a lesson for the patient. So that after 2 minutes, stop yourself, tell the patient, if are you with me? Are you following me? Any question. Sometimes also to ask me, is that clear for you? Do you want from me to repeat anything? To make interruption. Yourself. Again, check communication and the medical and the legal and the ethical issue to discuss here. After finish the main task, patient could be ask you some questions. Okay, no problem. We'll discuss this later. You have to ask about the concern direct question. Do you have any concern? It is a direct question. Do you have any concern? Actually, the patient has paper written at 2 or 3 questions. When you underwritten that concern, underwritten 1 or 2 questions, so that the patient will tell you his concern. Please again, don't forget this. Once the patient asked you or tell you the concern, you have to answer it. And answer of the concern, it is a vital. Because some candidate, it is escaping from the answer. When the patient asks you, doctor, this disease is curable or not? Some candidate tell, it could be curable, it could be non-curable. No, you have to give you answer according to your clinical knowledge and information. If the cancer and the metastasis, you tell him, I am sorry to inform you that this disease, it is not in the lung only, it is spread also to other organ and in no surgery for this disease. I am sorry to inform you, it is only palliative treatment. That is mean we control your symptoms, so that your answer should be clearly and your answer should be accurate. Again, once you asked about concern, after finish the main task, you have to answer the concern. Concern is the most important skill in the exam. Why? We have concern in station 2 in history, station 4 communication, and 2 cases in the station 5. Concern is about 16 marks. 16 marks. In each station, 4 marks. 4 marks in history, 4 in communication, 4 in the first case of clinical, first case in station 5, and second case in station 5, also 4 marks. If you lost 2 concern or 2 stations concern, you will not pass the exam. So concern is a most important skill. You have to manage it in the right way and to answer it clearly. Now, we mentioned introduction, main task, concern, then end of discussion. End of discussion, it is very, very important because a lot of candidates forget it. And during our lecture today, I mentioned that check understanding in the manage patient concern scale. It is written in the mark sheet. End of discussion. Number one, you have to summarize the discussion and emphasize about important notes by saying to the patient, I will summarize now the important note in this discussion. Don't give more time for summary, just to highlight the important note. Don't repeat the discussion again. You are in this area, you have to tell, we are going to tell the examiner about that we make summary, not more than this, so that you take only some few seconds, not more than 30 seconds. I am going to summarize for you most important issue today. You were admitted to the hospital by chest pain, and we make tracing of your heart and imaging in your lung. And I'm sorry to say to you, we found that blood clot inside the blood conduit of your lung. And as I told you, we'll admit you to the hospital and we will give you medication. This medication will make thinning of the blood and will admit you until we reach your blood thinning to the therapeutic range, and you will discharge after that and follow up in outpatient clinic regularly. This is the summary, not more than this. Second, we'll tell the patient, I appreciate we have covered a lot of issue today. Is there anything you would like from me to repeat it again or to go over again? The patient will reply, no, actually. Check understanding is very important. You will tell the patient, I hope our discussion is useful for you. Can you tell me how much you get information from me? The patient will tell you about the issue he want or issue he understood it during the discussion. So that it is very, very important to check understanding for the patient. Number four, help. You have to offer help to the patient, like these websites and leaflet, brochure and videos about your condition, about pulmonary embolism. You have to read it, and if you have any question or any inquiries about your problem, this is my contact number. You can contact me at any time. It is a help. Again, this is a standard. Each case we have to do that. Each case. But in case of this, don't mention the patient, I will give you a website or brochure about this. It is not practical. Okay? Or number four, help. Number five, we'll tell the patient, I hope you have found our discussion useful to you. Do you have any further question or concern? It is one of the important question here. I hope you have found our discussion useful to you. Do you have any further question or concern? Maybe sometimes there's a hidden concern you didn't discuss and the patient wait to repeat it again for him. So that it is very important to ask and repeat again for the patient. Do you have another concern? Then thank you for the patient and shake hand. So, end of discussion, we have 6 items. Number 1, summarize. Number 2, ask the patient if he wants anything to repeat it for him again. Number 3, it is check understanding. Number 4, help. Number 5, do you have any other concern? Number 6, thanks and shake hands with the patient. Now we reach to end of scenario during exam or your preparation. What can I do during 1 minute for reflection? So that we will wait 1 minute before discussion with examiner or your colleague during preparation. Don't consume this minute in blaming yourself if you missed an item, but in your mind it is overall satisfaction. One item will not affect you at all. Don't blame yourself if you forget an item during discussion with the patient. It is overall satisfaction. You have to make rapid interpretation of your case and emphasize again about ethical, legal, medical, social, and public issue as I mentioned before. Be sure, again, be sure, all questions with the examiner, you already faced it during your preparation in our course. So that feel confident at all. We did a lot of cases during preparation and it is repeated cases. So be sure, all questions, he will ask you medical items about your case or some ethical and legal issue. Be sure and be confident you will answer this question, inshallah. Inshallah. So that make proper plan and proper practice will make all this stage is too simple. As I mentioned before in my introduction, you will do it but your subconscious mind. So that is don't feel that it's too hard. It's too simple. If you do it regularly, it will be a habit. Please, again, do it simply, and your way of preparation will determine your way of pass of the exam. Feel confident about your preparation and your exam will go simply and no need for hesitation. Again, this is a simple preparation for communication, and also I would like to say in the next presentation or lecture I will speak about each case separately. We have now introduction, it is the same. End of discussion, it is the same. First part of the main task, it is the same. So in this meeting or in this lecture, about 40% of communication of skills we discussed it. In next lecture, I will speak in details about how to break bad news, how to handle angry patient, how to go through the explanation of chronic illness, how to explain the procedure, what is the criteria of consent, and what is the criteria of post-mortem examination. I hope all of this will be simple for our candidate, and see you in speak about it soon. And again, thanks for Dr. Khatib about his effort, and see you inshallah in the future. Thank you. Bismillah ar-Rahman ar-Rahim. This is the third lecture in our course for serious videos of communication. First of all, I apologize about the voice today because I have sore throat. Today I am going to discuss decision. Who is responsible about health decision? Is this for the team? Is this for doctor or relative? Our lecture today, who will take the decision and who is responsible to apply this decision. These rules for health decision, it is under control of Mental Capacity Act, and each person in the medical decision pathway has a responsibility, and each one should know which his responsibility. What is the Mental Capacity Act? in the basis exam. Mental Capacity Act, these rules made to apply it during discussion with patient or during discussion with relative, or if there is no relative or no anyone appointed to take the decision on behalf of patient. This is called health decision. Is this doctor or nurse or care provider or medical director who is responsible about health decision? Before we speak about the health decision, I would like to say in communication station we have to think about each words we are going to tell the patient or examiner about it. So, before you speak, your words have to pass through 3 gates. At first gate, ask yourself, is this information true or not? Is it true? At the second gate, you have to ask, is it necessary? At the third gate, you have to ask, is it kind? We are here to check the 3 gates. Our information, is it true information or not? And is it necessary to discuss it or not? That's according to your task. Don't imagine another task. And don't say something you didn't request, you didn't see it in your task. Third one, is it kind or not? Because we in communication station, we have to keep the patient most of the time quiet and didn't affect him physically or psychologically. So that before you speak again, we have 3 gates. Each word have to pass through 3 gates. As I mentioned before in introduction, it will be by your subconscious mind. So from now, before you attend your exam, you have to make rehearsal for your subconscious mind. Again, if you have knowledge, you will speak well, but the wisdom to listen well also to the patient. Again, if you have knowledge, you will speak well, and the wisdom to listen to the patient carefully. As we are going today to speak about consent and who will take the consent, put in your mind, no one can make you feel inferior without your consent. So, in the exam, you have to be confident. No one can make you feel inferior without you have consent. And your silence is one of this consent. But in our practice, silence of the patient doesn't mean this is consent. The consent should be written. But there is verbal consent for examination or starting scenario, as I said in the introduction. The most problem in communication or in exam, you feel you are inferior to examiner. Put in your mind this information. You have a lot of knowledge and you have a lot of information, maybe more than the examiner. But the problem is you give a consent, you are inferior to them. So you have to make yourself self-satisfied and you are superior to others. There is a problem in communication Communication station, sometimes there is illusions and hallucination coming to the candidate. He imagined something didn't written in the scenario. He imagined that he did this information and he said to the patient some information. Again, avoid illusion and hallucination. After this small introduction about the consent and about the gates that we have to pass through it for each words before you speak it, and about the consent, let us to start with consent. Consent mean two types. There is verbal consent and written consent. Verbal consent, before you examine the patient, Mr. Muhammad, could I examine you? Mr. Muhammad, could we discuss together your case? This is verbal consent. But written consent, it should be for all procedure. Please put this inside circle. Okay? Each procedure have consent. We have two blood tests need consent, genetic test and HIV. All procedure need consent. Genetic test and HIV need also consent. All other blood tests no need consent. How can I sure this consent is valid? Validity of the consent. How can you sure after you married this paper contract between you and your wife is valid? So consent should be informed one. What is mean by informed? Informed mean you told the patient about everything about the procedure, even if it is minor complication could be happened. And the patient tried to know everything about the procedure. Number two, the patient should be competent and have capacity to make decision. The patient should be competent and have capacity to make decision. That is mean the patient should be conscious, alert, and can understand information and outweigh the benefit and the risk of procedure, and he can give you decision. That is mean capacity. Number one, informed. Number two, capacity. Number three, the patient should be volunteer. No pressure for the patient, no pressure given to the patient from the doctor or family to do this procedure. The patient should be volunteer. Number four, continuity of the consent. Means that the patient has the right to withdraw consent before the procedure done. I will not belay, doctor. I will not belay here. This continuity of consent. If you have a consent, you have to cover this four area. I said before in many lectures about consent, and I give an example for that with paragraph. I will say it again and again, and I will tell you have patient now is candidate for liver biopsy. And after you explained for him everything, now you have to tell him to sign a consent. This paragraph, keep it in your mind. Mr. Ali, I explained for you now the procedure of liver biopsy, and I mentioned for you everything about it. I also informed you about the possible complication could be happened. First of all, Mr. Ali, feel free to agree to do this procedure or not. That is your right, and that is your right to do this procedure. Also, I will submit for you paper. This paper contains the name of the procedure and what is the benefit and the risk of this procedure. And also the complication could be happened during the procedure. You have to read it carefully. And if you have any comment or inquiries about anything related to the procedure, you can contact me. After that, you have to sign the consent before the procedure. And I want to assure you, even if you signed the consent and you want to withdraw this consent before the procedure, that is your right. Feel free to do that. What do you think about that, Mr. Hari? Simple way, this is the consent given to the patient. Now, I am going to explain what is the pathway of consent. We have many patients. Patient has capacity, patient unconscious, patient has advanced directive or living well, patient has last power attorney, patient alone and he is unconscious. So, let's start to check this pathway. Keep, please, your keep please your mind with me and give me all your attention and concentrate well in this slide. This slide contains a lot of information about the Mental Health Act, and it's a summary of most of scenarios that you may be encounter it in exam. First, is this patient has capacity or not? This is the first question. Is this patient has capacity or not? Okay. Yes, this patient has capacity. What does the capacity mean? If you look to upper left part of the slide, you will find the criteria of capacity. Criteria of capacity is the patient has to understand the information and retain this information and outweigh the benefit and the risk of information. Then he can communicate this information. These 4 criteria for capacity. Again, repeated again. And the repeated information always for pioneer people. You have to understand information, retain information, outweigh the benefit and the risk, and communicate this information and decision. If has capacity, the decision for the patient. That's right? Type, okay. If the patient doesn't have capacity, what is the next? I will ask if this patient has advanced directive or living well or not. Yes, if the patient has advanced directive and living well, we will follow it. And this advanced directive is valid. Again, capacity or not. Has capacity. يبقى the decision for the patient. No capacity. I will check advanced directive. If he has advanced directive, we will follow it. If no advanced directive, I will ask about last power attorney. If the patient has last power attorney and it is valid, I will explain later what's mean by last power attorney and what is advanced directive in detail in this lecture. If the patient has last power attorney and this last power attorney mentioned in his registration, he can take decision on behalf of patient. Even in the serious condition, we can follow last power attorney. If no last power attorney, we will do best interest for the patient. I explained in the introduction what is meant by best interest for the patient, and I will repeat it again. Best interest, if the patient doesn't have capacity, we will do the best thing for the patient. Okay. But we have now two pathway. Capacity, the decision for the patient. No capacity, we have three pathway. Has advanced directive, will follow it. Last power attorney, will follow it. Has no advanced directive or last power attorney, will do the best interest for the patient. I will speak later about the independent mental capacity advocate and what that mean. But we have to put this in our mind now. The patient has capacity or not? Has capacity, again, his decision. What is mean by his decision, please? Yes, the decision, he's agree about the decision of the medical team, but the patient or relative doesn't have right to request any medical treatment. This rule, the patient or relative doesn't have right to request any medical treatment. If no advanced directive, will check last power attorney and patient wishes. I will give an example in this issue. Now, I am discussing the case with a relative. I am discussing about big tube insertion. Now, I will tell the relative, after I explain to him what is the benefit and the risk of the procedure. Mr. Ali, could you tell me if your father have any advanced directive or living will? No, doctor, he doesn't have any. Your father appointed anyone to take a decision on behalf of him when he lost his capacity? No. No, doctor, he doesn't appoint anyone. Mr. Ali, could I ask you what the wishes of your father if his condition become like that? I mean, he doesn't he express for you about his wishes when he lost capacity? No, doctor. So I asked about three parties, about advanced directive, last power attorney, and the patient wishes. This is dealing with unconscious patient. Now, after that, we'll go in details and deeps more and more inside the Mental Capacity Act. Sorry. First, what is the summary of decision making? First, assess the capacity. After that, best interest, advanced directive, last power attorney, discussion with relative and caregiver, independent mental capacity advocate, court appointed deputy, court of protection, application to the court. What is that? Oh my god. It is very hard. It is very hard. It is very easy. Don't assume that it is very hard. Dr. Ahmed said, I think 3 hours ago, it is anti-headache. So, please keep silent and have a sit and take a cup of coffee and concentrate with me. This is the summary of decision making: assessing the capacity, best interest, valid advanced directive, valid last power of attorney,
discussion with relative and caregiver, independent mental capacity advocate, court-appointed deputy, court of protection, application to the court. By the way, all these lectures that I am going to do all content, it was the content of my book for communication. Let us by first one, as introduction of this lecture about the capacity. Mental Capacity Act, it is mean the ability to make a decision. A person lack capacity when they are unable to make a decision, when the decision needs to be made. The ability to make decision may be affected by a number of conditions like stroke, dementia, head injury, learning disability, and severe mental illness. Patients may lack capacity temporarily only, like acute illness or alcohol intoxication, or maybe in accident. This capacity could be also permanent. The summary of these slides: Mental Capacity Act, who will take the decision when the patient lost capacity. This is the summary of this slide. And also, the capacity could be lost temporarily or permanent. If you have a basic understanding of the Mental Capacity Act, you should be able to deal with any ethical dilemma around it without any difficulty. As we said now, you have to know everything about the Mental Capacity Act. And if you know that, you should be able to deal with any ethical dilemma around it without any difficulty. You will sit in the exam and speak very confident and in ease by your subconscious mind. In the exam scenario, you may be given situation which will require some form of decision making on behalf of patient who lack capacity, where you are unsure if the patient has capacity to decide for the treatment or involving a family member in the decision making process. The situation that may arise are consent for a procedure or urgent treatment, or withholding treatment and acting in patient's best interest. We have 5 core principles of this Mental Capacity Act. We have 5 cores. We can say 5 fingers. Okay. Person must be assumed to have capacity unless established otherwise. Yani each person have capacity until proved otherwise. By other means that you are a doctor until proved otherwise. Number 2, each person should be helped to make his own decision. No pressure. Feel free to do that. Number 3, a person is not to be treated as unable to make a decision merely because he makes unwise decision. There is justice. I told you before, maybe patient refused to do liver biopsy, so that didn't tell him, no, I will not treat you. You take unwise decision. You have to treat him. By other way, if you admitted the patient for infective endocarditis and this patient wants to charge, against medical advice. His right to discharge against medical advice. If she did that, don't tell her, I will not write for you medication because you go home against medical advice. This is the explanation of third principles. Any decision and action must be in the best interest of the person lacking capacity. If you have patient lacking capacity, should be in the best interest. What is mean by best interest? Means that is something good for the patient. All decisions and action must be the least restrictive of the person's right and freedom of action. Please, again, all decision and action must be the least restrictive of the person's right and freedom of action. All five are equal. These five principles are equal. To explain more and more and more and emphasize about the Mental Capacity Act, it is very important, Mental Capacity Act, to understand it. It is one of the vital area in the communication. Every adult has the right to make his or her own decision. We have to be equal, his or her. Every adult has the right to make his or her own decision and to be assumed to have capacity unless provided otherwise. Until provided otherwise. Again, every adult has the right to make his or her own decision and to be assumed to have capacity unless proved otherwise. Everyone should be encouraged and enabled to make his or her own decision. Individuals has the right to make unwise decision. I have now one patient has hematemesis and his hemoglobin is 6 and he refused blood transfusion. Yes, it is unwise decision, but he has the right. If he has capacity, he has the right to refuse any procedure. For capacity, we have 4 criteria for capacity: understanding information, retaining information, outweigh the benefit and the risk of the procedure, communicate his decision. Look for this photo. You will find doctor and the nurse fighting together in front of the patient, and the patient is opening and close his eyes. He feels frustrated so that he can't understand any information. So, capacity, understanding information, retaining information, outweigh the benefit and the risk of the procedure, and communicate his decision. Maybe the examiner asks you in the exam, what is the criteria of capacity? We have this criteria. Capacity. If this patient have 2 stages, if the patient is there any impairment or distribution to the function of the brain or mind, if the impairment or this distribution sufficient that the person is unable to make the practical decision. Actually, in the exam, they will not give you the patient without capacity. All patient has the capacity in the exam. But maybe this for examiner could ask you any question so that we are ready for any question. Person with duty of care must assess capacity to make a practical decision at the time the decision needs to be made, and shouldn't assume that person can't make any decision. Person's loss of capacity may be temporary only, as I said, and the capacity could be fluctuating. Some people may lack capacity to make complex decisions, but retain the capacity to make other decisions, like demented patient. What mean by incapacity? Incapacity could be temporary or permanent, decided on balance of probability. Avoid making capacity assumption on the ground of age, appearance, condition, or behavior, because one patient age may be 16 and he has capacity to make his decision. Next one, advanced care planning, ACP. Advanced care planning. I think you finished half of your tea or coffee, and give attention again for me for advanced care planning. Take the breath and listen to me. Advanced care planning, it is a continuous process of discussion between an individual and his care provider. Again, it is a continuous process of discussion between person and his care provider. Advanced care plan discussion may include individual concern, important values or person goals for care, his understanding about their illness and prognosis, what is the benefit for patient in the future and the availability of this benefit. Mental Capacity Act requirement to take account of these value, wishes of patient when assess best interest for the patient. These view must be taken into account of the caregiver. Advanced care planning, it is a continuous process of discussion between an individual and his care provider. Mental Capacity Act requirement to take account of the patient's value, wishes, and his expressed of his wishes or not, so that when I speak and I told you about the pathway of consent, I mentioned capacity and incapacity. Incapacity 3, number 1, advanced directive and living well, last power attorney, number 2, number 3, patient wishes, advanced care planning. Best interest decision. A person doesn't have mental capacity to make a certain decision. Any decision made in their behalf by anyone must always be in the best interest for the patient. Anyone will take the decision on behalf of patient should be in the best interest. Again, concentrate. Don't go away. Keep your mind with me. A person only has legal authority to make a decision on behalf of person if they are an attorney. Now, who will take the decision on behalf of the patient? Last power attorney or court appointed deputy, or if they have been given specific permission to do so by the court of protection. What is this difficult word? It seems so hard. No, it's too easy. Again, who will take the decision on behalf of patient? Last power attorney, and I will speak now about it. Court appointed deputy, it is one appointed by the court, or permission by court of protection to someone to take the decision. However, Informal decisions are made all time by those surrounding a person without capacity, but they must always be in the person's best interest. Who will decide the person's best interest? It is the person's wishes and values. Best interest decision must take into account certain factors. I am speaking a lot about the best interest because in the exam, if the patient doesn't have advanced directive or living well, we are going to speak about the best interest and the patient wishes and values. We have to see all relevant circumstances. This decision can be put off until the person has regained the capacity, if it's possible. I mean that you have patient now alcoholic. Actually, this is not in the exam. Alcoholic and he doesn't have capacity, and you want to do for him cholecystectomy. We have to wait. He comes with abdominal pain, and you find that he has cholecystitis. It is not urgent, so that we can wait and postpone the decision. Maybe the person would be participate in the decision, like alcoholic patient. The person wishes, feelings, beliefs, and values, especially if they were written down before they lost capacity. One patient wrote that I don't like to be resuscitated, and it already signed and stamped and dated, and there is witness. We have to follow this one, this advanced directive. Best interest for the patient, we have to take the wishes of the patient from his surrounding, family, friends, caregiver that appointed to act on behalf of the person. We have to be least restrictive of freedom. Is there any conflict evidence between you and the patient relative? Always provide clear and objective reason for the decision and why you believe it is a person's best interest. Again, best interest for the patient. It is your duty to consult other people when working out best interest for the person who lack capacity. The following people could be helpful for you. Now we mentioned and explained best interest. In summary, two words only. Best interest for the patient, don't do harm for the patient. If the patient doesn't have capacity and no advanced directive or living well, and at the same time no last power attorney, we will check his values and belief with relative or caregiver, and we'll put in our mind this value and belief if it is the best interest or not. Advanced directive and living well. This is a contract. Advanced statement affect the way people make decisions about their future care if they lose mental capacity. This includes decisions on whether they want life-saving treatment and participate in research. Advanced decisions can't be used to refuse basic care, including warmth, shelter, hygiene, oral food, and water, but not artificial nutrition and hydration. I think you have some coffee in your tea. some coffee in your cup, so that take deep breath. Advanced directive, something written by the patient when he has capacity, and we use it when he lost his capacity. And everything written in this paper, we have to follow it. The patient has the right to do that, but it's not the right of the patient to write, I didn't want to do in hygiene. It's not his right. How can I know this advanced directive is valid or not? How can I know that? Validity of advanced directive. Each advanced directive should be full details of patient, name and address of GB, and whether the GB has a copy of it or not, capacity, the patient has capacity, the patient is volunteer, and informed means patient knows the implication of the choice in his life. And this advanced directive should be clear statement of the decision and should be specify the treatment to be refused and which circumstances the decision should be used or which will trigger a particular course of action. Oh my god, what is this? It's blah 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 blah. No. The advanced directive should be clear. Decision written inside it. Specify the treatment. Why he refused this? Specify the treatment to be refused. And also, when we use this circumstance, when you use this advanced directive, should be dated and the time and documented. The patient has to be sign of the person, sign of witness. To know the validity of advanced directive, first we have four items. The patient should be have capacity and volunteer, like consent. Should be informed. Informed means implication of the choice in his life. And should be clear statement. What is the treatment he refused? What are the treatment he refused? He should write, I refuse to take any blood transfusion if I need it. So that we will not give him any blood transfusion if he lost capacity. I refuse to be resuscitated if my heart to stop, so that we will not do CPR for him. But if he has COPD and he need mechanical ventilation, we will do for him mechanical ventilation, because mechanical ventilation is different than CPR. He doesn't write in his advanced directive, he doesn't need any mechanical ventilation. So should be clear statement specified. And for any paper we use it should be dated, time, signature and witness. This is the criteria of validity of advanced directive. يبقى should be patient volunteer, capacity, informed, clear information about his decision, and specify the treatment to be refused and which is circumstances in which the decision should be used. Should be dated and signature and signed, and also signed of witness. Oh. When advanced statement can it be overriding? When we will not use it? Concentrate again. Take shallow breathing, not deep breath. Finish the shallow breathing? Yes. Okay. When this advanced directive, will neglect it, will not look for it. A validity signed last power attorney for welfare signed after the advanced decision can override it, especially if it gives the attorney the right to consent or refuse life-sustaining treatment. When we can neglect this advanced directive, if the patient wrote advanced directive and he has capacity and it is valid, after that 3 to 4 months he wrote last power, he appointed last power attorney. So the recent one will take it. If he wrote last power attorney after advanced directive, so the last power attorney will be the valid. Specify also what the last power attorney will take the decision on behalf of him. If it is not clear what is the treatment or what is the circumstances the person want to take it, we can neglect it. There are 2 causes to neglect this advanced directive. Override a decision made by a person who has got capacity. Refuse basic nursing care to keep the person comfortable. Refuse food or drinking by the mouth. All of this should be refused, and we will neglect that advanced directive. When we neglect, if recent last power attorney or it is unclear of the patient wrote refusing basic nursing care, we will not follow this one, or refusal food or something by mouth, we will not follow it. Demand treatment which medical professional feel is inappropriate. If the patient wrote in advanced directive or living well, he want to be, when he lost capacity, please doctor give me concentrated electrolyte and kill me. We will not follow it. Refuse treatment for a mental disorder if the person is or is liable to be detained under the Mental Health Act. Again, it is very important. Maybe the patient has some psychiatric problem. He doesn't have the right to refuse treatment. Ask for anything against law, such as euthanasia, to kill himself. Because it is important to get this document right for it to take effect when the person wants. It should normally be drawn up by a lawyer solicitor. When we neglect the advanced directive, again, if we appoint recently last power attorney, if it is not clear, refusing nursing care, refusal food, demand treatment not appropriate, and refuse treatment of mental disorder, anything against law. This is the advanced statement or advanced directive or living well. 3 are the same. I know that this lecture is too long lecture, so that I want from everyone to make another cup of coffee and enjoy when we are discussing this Mental Health Act. We discussed advanced directive or advanced statement. The next one in the Mental Health Act, we will go through last power attorney. Last power of attorney is a legal document that lets the person to appoint people known as attorney to make decision on his behalf or on your behalf. It could be used if you become unable to make your own decision. This last power attorney, it is the same as advanced directive. But in advanced directive, the patient wrote what is about his decision when he lost his capacity. But here, in last power attorney, the patient mentioned that and he appointed one person to take a decision on behalf of him when he lost capacity or when he become unable to take decision. This is last power attorney. Last power attorney, it allows you means patient, to choose one person or more to make decision about things like your daily routine, your medical care, moving into a care home, sustaining treatment. So we the patient has to specify about the point that last power attorney will take the decision on behalf of him. Again, the patient has to specify about the point which the last power attorney will take decision on behalf of him. That's clear. If he mentioned to take of medical care, that's okay. But he didn't mention life-sustaining treatment, so that the last power attorney doesn't have the right to take decision in life-sustaining treatment. We will follow which written in the paper of last power attorney. This type of last power of attorney can only be used when you are unable to make your own decision. Here, this instruction to the patient. The type of last power attorney can only be used when the patient is unable to make his own decision. Who can be your attorney for the patient? Attorney could be anyone, any person above 18 years, could be relative, could be friend, could be a professional, could be your husband, your wife, or your partner. Validity of last power attorney. When we can say last power attorney is valid to take decision. Validity of last power attorney, person and the last power attorney both have capacity when he appointed last power attorney. The patient and the last power attorney, both of them have capacity. And we defined already what is mean by capacity. Person, this is the patient, and the last power attorney, both above 18 years old. Should specify it as anything should be specified what is the role of last power attorney in his to take decision on behalf of patient. Anything written should be signed and dated by both last power attorney and the patient, and to be documented or registered. That last power attorney must be registered with the Office of Public Guardian before it can be used. Validity of last power attorney, both above 18, both have capacity, should be specified, signed, dated, and registered. Everything should be signed, dated, and registered. Same like advanced directive and or living will. When the attorney can't consent in this in situation, يبقى doctor want to take decision and he has attorney. When this attorney we can't follow him, the donor has capacity to make the particular health care decision. يبقى the patient has capacity. If the patient has capacity, the decision for the patient, not for last power attorney. Last power attorney only if the patient lost capacity. The patient, he already done or wrote advanced decision or advanced directive to refuse the proposed treatment after he appointed last power attorney. What does that mean? He wrote already last power attorney after a couple of months, he made an advanced directive. So advanced directive will remove this last bar attorney because it is recent. If the decision related to life-sustaining treatment, except when making the last power attorney, the donor has specified a state in the last power attorney document that they want the attorney to have this authority. If we are facing a life-sustained treatment, and if the patient doesn't mention in the last bar attorney document about life-sustained treatment, we will not follow the last bar attorney. But if he mentioned this last bar attorney person, he can take a decision on behalf of him, we will follow that. If the patient under the care of Mental Health Act, Mental Health Act, it is no way. What is mean by no way? No decision for the patient or for last bar attorney. The decision for the doctor only, for doctors only. If the attorney can consent, if the patient has capacity, if he has recent advanced directive, if doesn't mention in the last bar attorney document about the life-sustained treatment, if the patient under care of Mental Health Act. I will summarize again. If the patient has capacity, he will take the decision. If the patient doesn't have capacity, we will follow number one, advanced directive or last bar attorney, which recent one, or will take the best interest for the patient. This is a summary of all this 57 minutes. We'll go now to other issue. It is called independent mental capacity advocate. Mental Capacity Act in 2005 create independent mental capacity advocate service as safeguard for people without capacity to make certain important decisions. In 2005, they appointment or they create a new job. It's called Independent Mental Capacity Advocate or IMICA, we can say it. What is the role of IMICA? The role of IMICA, an IMICA must be instructed and then consulted for people lacking capacity. But number one, the patient should be lack capacity, who have no one else to support them. If the patient has lost capacity and no one to support patient. If we are going to give serious medical treatment, we will consult this IMICA to inform him about the patient condition and explain to him what is the role of treatment and what is the benefit of treatment. If we are going to arrange home care for patient, and the patient no one can take his own decision and he already lost capacity, so we'll consult IMICA. If the person will stay in the hospital more than 28 days, if the patient will stay in the care home for more than 8 weeks. Again, role of IMICA. IMICA, if we are going to make a serious medical treatment and the patient doesn't have capacity and no one to support him, we will consult IMICA. If we are going to transfer the patient to home care and no one to support him, what does it mean by no one support him? No relative, no anyone, no caregiver. Person will stay in the hospital more than 28 days. Person will stay in the home care more than 8 weeks. This IMICA, this one person already, have the right to request a second medical opinion in relation to the treatment decision. Actually, in the exam, what is the role of IMICA? In your communication skill exam. Emika, you will not over him because you are always discuss the case with the patient or with the relative. And the patient, he can take his own decision, and the relative, it is one of support to the patient. But the examiner could ask you if this patient doesn't have capacity, and this patient can take his own decision and no one to support him. How can you proceed for the treatment for this patient, and you are going now to do for him this chest tube, but it is not urgent. If the chest tube is urgent, we have to proceed. But if it's not urgent, you can tell him you consult the EMICA, Independent Mental Capacity Advocate. So it is not too much coming in the exam, but to keep in your mind. If one of the examiner discussed with you this issue, you have to put in your mind EMICA. Oh, court. Now we're going to the court. Oh my God. Court appointed deputy. This person, one person, who is appointed by the court of protection to make decision on the health care, person welfare, or financial problem on behalf of patient. Essentially, it is a similar authority of last power attorney, except that they didn't have the power to refuse life-sustaining treatment. This is a summary. Last power attorney, it is appointed by the patient when he has capacity. Court appointed deputy, the court appointed one person to take the decision on behalf of patient, the same last power attorney, except that they don't have the power to refuse life-sustaining treatment. Also, in the exam, it could be discussion only with the examiner. Do you know what I mean by court-appointed deputy? Yes, I know. And we will be excellent in our answer if we said this. It is appointed by the court of protection to make decision on behalf of patient in the form of health problem or welfare and financial issue. It is the same like last power attorney, but court-appointed deputy doesn't have the power to refuse life-sustaining treatment. And we said already, last power attorney has the power to refuse life-sustaining treatment if it is mentioned in the last power attorney document. But if it doesn't mention, he doesn't have rule to refuse life-sustaining treatment. That is about last power attorney. Who can be a deputy? Court of protection will be appoint one. Who is this one? Deputy is usually a close friend or relative of person who need help to make decision. Maybe this deputy could be professional like accountant or solicitor. Local authority are often appointed as a deputy. Anyone can be appointed as a deputy according to the court. What is the responsibility of deputies? Or what is the type of deputies? Deputies, we have two types. One will look for financial affairs, and one will look for health problem and welfare. Maybe more than one person appointed as deputy to each type. Maybe the court will appoint one for health care and one for financial affairs, or one for both. What is the responsibility of appointed deputy? The court of protection will tell the deputy about his power and responsibilities, what decision they can and can't make. Deputies must only make decision in other person's best interest. Again, the deputy should make a decision in other person's best interest. Only make the decision the court says they can make. Apply a high standard of care when making a decision. The deputies must be only make decision on the best interest for patient, and make decision that the court says he can do it, and also should be high standard of care. These deputies that appointed by the court, he can't take decision to restrain the person unless it stops them to coming to harm. He can't take decision about life-sustaining medical treatment. He can't make a will for person. He can't make large gifts out of the person money, hold any money or property in their own name on the person behalf. For ourselves, to avoid confusion, this deputies for us doesn't have the rule to stop sustained medical treatment or restrain the person. These two rules. Others is related to financial affair, so that restraining person and stop life-sustaining medical treatment doesn't have rule at all in the court-appointed deputy. Oh, court. We know now IMICA, Independent Mental Capacity Advocate. We know court-appointed deputy and what is his rule. And the rule, it is the same. We can say it is the same like last power attorney, but without life-sustained medical treatment. He can't take decision. And now we'll go to court of protection. The court of protection, it will decide whether a person has capacity to make a particular decision for themselves. Decide this person has capacity or not. Make declarations, decisions, or order on financial or healthcare matter affecting people who lack capacity to make such decision. Appointed deputies to make decision for people lacking capacity. Decide whether an last power attorney is valid or not. Remove deputies or attorneys who fail to carry out their duties. Again, court of protection, it is the final issue. It will decide this person has capacity or not. Maybe court of protection will take decision on behalf of patient, and if the patient lack capacity, it could be appointed anyone to make decision for people lacking capacity, and there is confusion between doctor and the last power attorney, they can decide. Remove deputies or attorneys who fail to carry out their duties. In the exam, how can you handle this? The examiner could ask you, if this patient lack capacity and no one support him, I will tell him we can go to EMICA or go to the court of protection. And EMICA, we know the rule, and the court of protection could be appointed one to take a decision on behalf of patient other than life-sustained treatment, or this court of protection itself could be take a decision. This is the answer. If we have patient lacking capacity, we can go EMICA or go to the court. Court could be appointed anyone to take a decision on behalf of patient except life-sustaining treatment, or the court itself could be take a decision. If we have a conflict between us and last power attorney, that we can go to court of protection. But please, again, it is not coming a case in exam. And I mean that in the exam, they will not give you one have last power attorney, and this last power attorney refuse medical treatment that could be help the patient. Actually, last power attorney will work on the best interest for the patient, but in the exam you will not face any confrontation between you and the last power attorney. We didn't see it in the exam. This is last one. We have now three ways, as I said in summary again, three ways. We have patient has capacity, he has decision, no capacity for the patient, so that the patient will go through advanced directive. If no, will go last power attorney. If no, nothing like that, will go to the patient wishes. If no, will go to best interest for the patient. This is the pathway of consent. Other than this, we can go to EMICA, and we now know the role of EMICA, and also will go through the court of protection, or appointed by the court, and we know what is the role of court appointed deputy, that appointed by court of protection, and the role of court of protection. For example, some capacity cases which should still go to the court. If we are going for organ or bone marrow donation, organ donation by person lacking capacity to consent. One person has brainstem this and lack capacity, and he doesn't have any advanced directive or donor card, and no one to support him, so that we can go to the court to take. The court will take a decision if we can proceed for organ donation or not. If the person for organ donation again should go to the court when if this patient has lack capacity, number one. Number two, no donor card or advanced directive that he want to donate his organ. Number three, no next of kin or no one support him. If we have patient in persistent vegetative state, for withdraw or withhold treatment, we have to go to the court. Non-therapeutic sterilization, some termination of pregnancy case, and we have a lecture about abortion. We will see it in the coming days. Cases where we are doubt or dispute about whether a particular treatment will be in a person's best interest. Cases involving ethical dilemma in untested area. Just only for theoretical knowledge, we will go to the court when if bone marrow transplantation or organ donation and no one can support the person, and no person lacking capacity, and no advanced directive or donor card. For withdrawal treatment for vegetative state, this is some cases of termination of pregnancy. This is the capacity cases which should still go to court. I know that there is still some coffee inside the tea, and maybe you have headache, and maybe you feel confused about all of this information that we discussed today. And I can say it is one of the difficult issues to understand in communication, to know what is the role of the patient, and what is the role of doctor, and what is the role of next of kin or last power attorney. But I can say at the end of this lecture, it is so simple, and I said at the start of the lecture, communication is very easy if you know your role and you know the duties of other. I will go summary now for Mental Health Act. First, we have to decide the patient has capacity or not. Number one, in the exam, if you are sitting in front of the patient, that means this patient has capacity. Don't bother yourself, he has capacity or not. Once the patient in front of you, he has capacity until proved otherwise. This is the first rule. Second rule, if the patient has capacity, the patient has capacity and he refused treatment, he has the right to refuse any medical treatment, even if we feel his decision is unwise decision. Number three, if he doesn't have capacity, we have to follow the pathway. First, we'll ask advanced directive or living will. If no, we'll ask about any last power attorney. If no, we'll check the patient wishes or patient best interest. And we explained what is mean by patient best interest and when we can use this patient best interest. Best interest only if the patient doesn't have capacity. We can do the best interest for the patient. if no last power attorney, no advanced directive, we will follow to the best interest for the patient. And we explained in details what is meant by independent mental capacity advocate and what is the role of EMICA. And one of the role of EMICA, he can request second opinion. We have to consult EMICA. If there is no EMICA, we can go to the court of protection. They will appoint one to take a decision on behalf of patient except life-sustained treatment. This is the mental capacity decision-making pathway. If you have any inquiries or any questions about this pathway, you can contact me at any time. Feel free to contact me. It is the same, we have to tell the patient at the end of communication. We have to give him a help and support him. Please, in the exam, this mental capacity decision, it comes usually by different ways. Maybe we'll explain to the patient a procedure and the patient is now he is conscious and alert. He has the right to accept or refuse it. Maybe you want to explain to the son or daughter of patient about procedure. One patient come for you with sudden loss of conscious and you did for him CT and you find that in the CT is the subdural hematoma and need an urgent surgery to evacuate this hematoma. When you communicate with his son, his son you asked him and his son deny any advanced directive for living well and also denied last power attorney, so that we'll ask him what is the wishes of the patient. Does your father express, or did your father express about his wishes when he become in this situation? And also we have to explain to him the benefit and the risk of the procedure. We will come later in the coming lecture to explain what is the best way of explanation of disease and explanation of procedure. It could become again this best way you explain to the patient or explain to relative or explain to caregiver. And feel free please during exam to become during preparation to contact me, and I am saying and always say that please don't go in confrontation with the patient and the family. You have to become like a political persons. They speak a lot but they will not do anything. We have the same here in communication. You can speak well, you can convince the patient or family, but please don't go in confrontation. Like if the one of member of family insisted to refuse a procedure, please didn't tell him during the exam it is not your right to refuse this procedure, as your father lack capacity and no advanced directive and no last power attorney. The decision for the patient, for the team looking after your father, didn't say that to the surrogate or say that to the relative of patient, because you will go in confrontation and you will affect your marks, especially in the welfare. So if you face such situation in the exam and he insists to refuse, tell him the benefit and the recurrent again the benefit of procedure and what is the good things will come to your father or your mother. And if he insists, tell him you can think in this issue for couple, if not urgent case, for couples of days, and you can come back again and we'll do another meeting with consultant. But in cases with urgent like subdural hematoma, we have to convince. We have to convince in polite manner and in professional manner, like political persons. Again, be political person, not in your life, please. In the communication skill exam only. When you discussing the condition with patient, become like political person. It is as I said, it says a lot of good things, but they will not do anything. We have to follow this rule, and but in communication only, not in our daily activity. Again, this is the third lecture, and inshallah in coming days we'll arrange the next lecture, maybe about confidentiality or about the explanation of disease. I will decide later. And thanks again for your patient to be with me here for more than 1 hour and 20 minutes. And I hope that it's successful presentation, and you will get a lot of information from this presentation. And again, thanks for my dear friend Dr. Al-Khatib for his effort, as he will, after I will finish this lecture, I will submit for him the lecture, and he will do some steps to become available for all in social media. I thank him again for his effort. Last, you have to be like this person during preparation and during exam. You have to be confident and thinking. As I said at the start of this lecture, each words has to go through gates before coming of your mouth. Communication is an easy station if you follow instruction. Thank you. Good luck.